6,000, 8,000 cases at the same time? Is that what you're saying? A day?
A day.
New cases a day?
Yes.
Remember that? Nearly 8 months after Dr. Amy Acton first made that prediction, Ohio's peak surge of the coronavirus might have finally arrived. Acton's warning came back in March, and today Ohio topped 6,000 new cases a day for the first time, with a record high of 6,508. More concerning, the state is shattering its previous record for new hospitalizations. 386 people going to the hospital within the last 24 hours. But health experts say these high numbers are not really a shock. So what needs to be done to get those numbers to go back down? NBC4's Danielle Grossman live tonight in Columbus. And Danielle, doctors, what are they saying about this record-smashing day for COVID-19 cases?
Yeah, it's scary, right, Colleen? Well, some doctors I talked to today said it's probably Halloween. Those OSU games in the beginning is contributing to the recent numbers we're seeing right now. But these high numbers and this spike in COVID-19 cases, they tell me they're not surprised.
Oh, no, that's not good.
That's the reaction from some people when they got the wind of the drastic spike in COVID cases, over 6,500 in 24 hours.
Unfortunately, I think we were distracted with just everything that was going on in the country and, lost sight of what we know works.
Dr. Nick Command from Ohio State University says he doesn't expect this trend to slow down unless something's changed.
And so when these rates go up, no one's immune.
When it comes to travel, I asked if he thinks travel restrictions would help our numbers.
I think we can be smart and still potentially travel if we have to.
And Dr. Mark Herbert from Mount Carmel says we just need to be smart right now.
I think we all need to be cautious about travel. We all need to be realistic.
Dr. Command has some advice. Check the CDC website because they update most at-risk states every few days. Flying's fine if you can ensure everyone wears a mask, but driving with your household and being safe along the way may be the best option.
For what are you doing when you get to where you're going?
He wants to remind travelers to use the same tactics we've been practicing here wherever they end up. New to Columbus, Kevin Oiska says he's going to just play it safe this winter.
Have not been traveling. For holidays, I'm definitely going to be doing Zoom Christmas and stuff, maybe some virtual meals and whatnot. But yeah, nothing too crazy. And
Dr. Kamen says even if you take a test before attending a gathering, it could give you a false sense of security.
People are getting negative tests, but you might still have virus that you just aren't able to detect yet.
We just need to all go back to the basics.
Now, we talk to physicians on an almost daily basis now with COVID-19, and the doctors I talked to today say that the staffing is becoming very scarce, and they're just really hoping the community buckles down and steps up to help our caregivers when they're needed most, to treat those patients with COVID-19 that are being hospitalized. Live and local for you in Columbus, Danielle Grossman, NBC4.